Good day! I am Rodilyn Palomero from 3BSNB. So for today, I will going to demonstrate the proper procedure of doing a Unang Yakap or essential intrapartum and newborn care. So to start, newborn care was conceptualized in order to have an early initiations of breastfeeding. A simple cost-effective intervention that can improve neonatal as well as the maternal care. So the step-by-step intervention for EI and CR. First is immediate and true drying of the baby, early skin-to-skin contact with the mother and the newborn, then properly timed cord clumping, non-separation of mother and the baby for early breastfeeding. Purpose, promotion of breastfeeding, emphasize on the need of breastfeeding within the first 60 to 90 minutes to improve breastfeed rates in the Philippines. So, the procedure for this is prior to the woman's to DR, ensure that the mother is in her choice of position while in labor to promote relaxation and comfort. Ask the mother if she wishes to eat, drink, and boil. So, good morning, ma'am. I am your student nurse for today. My name is Judilyn Palomero. So, ma'am, are you comfortable with the choice of your position, ma'am? Thank you po, ma'am. Baka gusto niyo po munang uminom, umihi, or should I say, uminom or kumain po muna or mag-void po, ma'am? Sige po, thank you po, ma'am. Then communicates with the mother and informs her of progress of labor to give reassurance and encouragement. So, ma'am, gusto ko po sana malaman nyo na, ma'am, na sana po is maki-cooperate po kayo sa amin, ma'am, para hindi po kayo mahirapan sa panganganak. Sige po, ma'am, thank you po. Then, woman's already in the DR preparing for the delivery. So, checks the temperature in the DR area to be 25 to 28 degrees Celsius to eliminate the air drop. So, assume that I am in the DR room. So then ask woman if she is comfortable in semi-upright position. Proper positioning ensures better visualization. Then ensure woman's privacy. So, ma'am, good morning once again, ma'am. Are you satisfied with your upright position po, ma'am? Sige po, ma'am. Thank you po. Then, close the curtains, the door, and the window. Then, ensure the privacy of the patient. Then, next is removes the dew release, wash your hands, and observe the WHO or WHO 1, 2, 3, 4, 5 procedure. So, removing the dew release. Then, with the use of alcohol, I will disinfect my hand. To deter the spread of microorganisms. Then, prepare a clean newborn's resuscitation area on a firm and flat surface. Check the equipment if clean, functional, and within reach area. To save time and work is systematically. Then arrange the supplies in the linear sequence. So these are my equipments. So sterile gloves, 2 pieces of dry towel linens, bonnet, blanket, 1 bonnet, oxytocin, hepatitis B, vitamin K, or eye ointment, sterile plastic cord clamp, kidney basin with antiseptic solution with cotton balls. So, the first thing to do is to cleanse the perineum with antiseptic solution or the betadine. So, to deter the spread of microorganisms. So, ma'am, i-cleanse ko po muna yung perineal area niyo po, ma'am, ha? Bago tayo magsimula. Focus niya, ha? Then, wash hands and put 2 pairs of gloves aseptically. So, so, I'll wash my hands again with the use of alcohol. Then, at the time of delivery. So encourage the mother to push as desired. So, ma'am, gusto ko po sana mag-push lang po kayo ng push para hindi po kayo mahirapan. Push lang po, ma'am. Push. To provide the support system. So, drape a clean, dry linen over the mother's abdomen or arms in preparation for drying the baby. So, the baby is out at 3:45 p.m. So, it's a girl. So, calls the time of birth and sex of the baby and informs the mother of the outcome. Ma'am, lumabas na po yung anak niyo po and it's a girl po, ma'am. Congratulations po. So, thoroughly dries the baby for at least 30 seconds, starting from the face, head, going down to the trunk, extremities, while performing a quick check for breathing. Stimulus the baby's breathing, provide warmth to the newborn. Then, remove the wet cloth and place baby to skin contact on the mother's abdomen and chest. Skin to skin contact facilitates bonding between the mother and her newborn. Covers the baby with dry cloth and baby's head with a bonnet. Then, place identificational band on the ankle and proper identification of the newborn. Assume that this is my identification. Then, exclude the second baby by palpating the abdomen in preparation for giving oxytocin to check for the second baby or multiple birth. Okay. Then, gives IM oxytocin within 1 minute of the baby's birth after wiping the soiled gloves with a wet cotton and dispose the wet cloth. Ma'am, mag-inject lang po tayo ng IM, ma'am. So, ma'am, i-inject ko na po yung oxytocin po, ma'am. Thank you po, ma'am. So, thank you po, ma'am. Then, to prevent bleeding to the mother and deter the spread of microorganisms within the proper disposal of used cloths. Thank you. Then, remove the first set of the glove, positioning the baby for the cord clumping, and decontaminates the gloves in a 5% chlorine, 0.5% chlorine solution for at least 1 minute. Then, palpates the umbilical cord to check for the pulsation. Check ko lang po yung pulsation ng baby niyo po, ma'am. After pulsation stop, clamps the umbilical cord using the plastic clamp or cord tied 2 cm from the base. Okay, assume that the pulsation already stopped. Place the instrument clamp 5 cm from the base and cut the near plastic clamp, not the midway. Then, perform the remaining step of active management of the third stage of the labor. Then, wait for a long urine contraction, then apply controlled clamp, cord traction, and the outer counter traction to the uterus, continuing until the placenta was delivered. So, massage the uterus until it's firm. Then, inspect the lower vagina and perineum for the laceration, tear, and repairs laceration or laceration tears as necessary. Then, examine the placenta for the completeness and abnormalities. Then, cleanse the mother, does perineal flushing, and applies perineal pad or napkin cloth. Then, assume that the mother, assume that we already done the cleaning. So, next, assume that this is a pad for the mother. Then, check the baby's color and breathing, up guard, scoring. Check the mother is comfortable and that uterus is contracted. Ma'am, are you comfortable with your position po, ma'am? Sige po, ma'am. Thank you po. Dispose the placenta in leak wrap container or the plastic bag. Then, decontaminate soak 0.5 chlorine solution instrument before cleaning. Decontaminate second pair of gloves before disposal, stating that this contamination lasts for at least 10 minutes. Then, advise the mother to maintain skin-to-skin contact. Baby should be thrown to the mother's chest in between the breast within head turned to the one side. So, ma'am, i-maintain nyo lang po yung skin-to-skin nyo po sa baby nyo po, ma'am, ha? Then, by 15 to 90 minutes, advise the mother to observe for feeding costs and cite examples of feeding costs. So, ma'am, observe nyo lang po yung feeding nyo, ma'am, ha? Dapat po yung baby po nag-breastfeed pa po, ma'am. Huwag na po natin i-stop, ma'am. Okay? Then, support the mother, instruct her on positioning and attachment. Waits for the full breast feed to be completed. So assume natin na tapos na po yung breastfeeding. So, after a complete breastfeeding, administer eye ointment first. So, eye care is given to protect the eye babies from infections or the babies from infections. Ma'am, maglalagay lang po ako ng eye ointment sa baby niyo po. Thank you. After that, proceed to the physical examination, the vital sign, anthropometric measurement, head to chest, abdominal, circumference, length, and weight of the baby. Vital sign. Head. Check ko lang po yung head ni baby, ma'am. Check ko lang po yung Next is the weight of the baby. Back in our okay. Okay. Then, after that, give vitamin K, hepatitis B, and BCG injection. Simultaneously explain the purpose of each intervention. So, ma'am, mag-inject lang po ako ng Hepa B at saka ng um, vitamin K sa inyong baby po. Thank you po. Then, advice optional delayed or batting for the baby. So, early batting removes the vernix, which is protective barrier. It is also hinders the crawling reflex and leads to hypothermia. So, ma'am, wag po muna natin paliguan si baby, ma'am, ha? Hanggat hindi pa po siya. Then, advised breastfeeding per demand. Let the baby feed for as long as she or he wants. So, ma'am, magbe-breastfeed lang po kayo ng baby hanggat gusto niya po, ma'am, ha? In the first hour of the baby, check the baby's breathing, color, and check the mother's vital sign and massage their uterus every 15 minutes. So, ma'am, okay lang po kayo, ma'am. Check ko lang po yung vital sign niyo, ma'am, ha? Ma'am, thank you po. Breastfeed niyo lang po si baby. Then, check the mother and the baby every 30 to 1 hour to prevent accidents such as falls and accident suffocation from occurring. Then complete all the records. Accurate documentations allow of comparison of the data. Then, before leaving the room, so make sure to wash your hands, remove the gloves, and throw it in a proper garbage can. Then cleanse the equipment. So that's all. Thank you.